presentation, I am doing it on continuous quality improvement on antibiotic resistance. Something that I have found interesting and decided to do my project on. Was able to learn more about it and hopefully integrate what I've learned into the hospital setting. Originated total quality management is what it has been called, specifies that there is one correct method of work for all workers and how to see that personnel executed that method to ensure quality. TQM fundamentals were based from scientific methods during the early 20th century, where management was really just based off of facts. Organizations have realized, they've grown, they know the importance of change, and that changes are important for improvement. There now must be learning interaction between all levels of a system, if that's top operators, employees, CEOs, all have to work together nowadays in order to find the best methods, the best solutions. TQM has now evolved to what we know today, or in healthcare as CQI. Why does healthcare utilize CQI in the first place? CQI uses structured planning to evaluate current practices and improve processes and systems to achieve a desired outcome. The definition more specifically says the combined efforts of everyone, healthcare professionals, patients and their families, researchers, payers, planners, and educators. To make changes that will lead to a better patient outcomes, better system performance, and better professional development. Elements that affect CQI include evidence-based practices. There needs to be evidence in order for any improvement to begin. Of course, all medical staff has to be present, have to be willing, and have to be able to work together in order to progress. There's also risk involved when doing outcome measures. Whenever change is made, there's always some sort of risk, but risk has to happen in order to improve. Cost effectiveness, always an issue, especially in healthcare. You want to make the most important improvements, but also being cost effective and efficient. Quality assurance data and risk management data are also involved. Here I found more of a illustration on CQI. Organizations really embark on CQI for a variety of reasons, including accreditation, requirements, cost control, competition for competitors, and then there is also pressure from employers and payers. Here you can see the illustration. First, starting off on the very left, you'll see a current state. In order to start CQI, you need people, you need process, you need technology. Without those three things happening together, CQI cannot really begin. Once people start working together, a process is formed, technology is involved, you start seeing improvement in patient care, improved population health, and reduced cost. CQI obviously is continuous. It's going to keep moving, it's going to keep improving as long as these three things are involved. An example, improve quality for customer preference, increase share in the healthcare market, and again, you want to meet accreditation requirements. This hospital does all that. We want to do CQI for the main reason, and that is to improve patient care, make sure they are getting the best quality. So what are we going to do? Antibiotic resistant CQI initiative starts next week. Growing problem in America. This resistance is a serious global health issue due to antibiotic overuse, and we are actually limited for antibiotic research. Inappropriate antibiotic exposure can lead to both short-term and lifelong adverse outcomes. If a host or a patient is experiencing this kind of resistance at a younger age, you can see the issues that's going to develop longer down the road. Antibiotics are very helpful, though. They do help fight off infection. They can be life-saving at times. If the population continues to overuse antibiotics in their bodies, will become resistant. infection will become harder to treat the more and more this problem grows. This is why we're going to take initiative. What causes this? First, I've already mentioned overuse of the prescribing of the drug. Another thing, patients not finishing their treatments. If patients aren't finishing their antibiotic treatment, it's going to go back to overprescribing because that patient's going to have to receive more drugs in order to fight off that infection completely. One thing that I have learned over the week and kind of connected is that antibiotics are put into livestock, fish farming. Growing up on a farm, I can relate to that. I know antibiotics are used pretty religiously when dealing with food. People consume them every day, even if they aren't aware of it. So that's important to note as well. Poor infection control in hospitals and clinics. Hospitals have to be especially clean. Virus and infection are very abundant in hospitals just because it's around all the time. Along with that, you have lack of hygiene and poor sanitation. Again, lack of antibiotic research is also an issue. So when these causes are happening, patients are seeing a mutation in their gene, which is what's causing the resistance. Overuse leads to the development of antibiotic resistance by supporting genetic alterations, such as changes in gene expression, gene transfer between species, and mutagenesis. Antibiotics actually remove drug-sensitive competitors, and these resistance bacteria room to grow inside the host. If resistance occurs, antibiotic therapy can weaken the host defense by disrupting gut flora. This makes the host more vulnerable during treatment and recovery. To better explain that, I have a picture right here. Bacteria that has initially worked or is responsive for a host can acquire resistance by mutation in genes or by receiving genes by different bacteria. Here you can see the bacteria fungi illustrated as an antibiotic is consumed, its effect, either direct and indirect damage on DNA. The DNA is then altered, then mutated into our DNA single nucleotide, and there's a couple chromosome examples as well. Just better illustrates how antibiotics can cause this resistance, how they actually mutate our genes when overused. How is this hospital going to decrease antibiotic resistance? Most causes of this growing problem originate in the hospital setting: overprescribing, patients not finishing their prescription, lack of hygiene, and more, poor infection control in hospitals. Those are a majority of the reasons I just discussed in the illustration. In order to improve this, we're going to do a couple of things to prevent bad hygiene and antibiotic pressure. We're going to improve our hand hygiene, reduce antibiotic prescriptions. We're going to increase our computer order entry and also rotate the use of antibiotics. There's always time to wash your hands before and after. Seeing patients, make sure to conduct hand sterilization. I know time is a leading excuse for this. There is a solution. Alcohol wipes are going to be stationed conveniently even more throughout the hospital. If washing your hands with soap and water isn't convenient, time-consuming at the time, grab an alcohol-based hand wipe. This takes 30 seconds at the most. All employees must be involved or partake in this initiative. Not just nurses, just not doctors, everyone all together in order for it to be effective. Restrict the use of antibiotics. Reducing unnecessary antibiotic prescriptions will decrease hospital costs and prevent resistance. Physicians and prescribers must make sure patients demonstrate necessary symptoms to receive antibiotics. Make sure if they are demonstrating these symptoms that they are receiving the right dosage, double checking that, making sure they have the right antibiotic as well. If prescribed antibiotics, make sure to also educate them, make sure they are finishing the dose As mentioned earlier, we do not want to leave the infection having to prescribe more antibiotics, leading to more leaving the hospital. All staff members must use computer entries for prescriptions. When antibiotics are given to patients, nurse staff members must complete a computer entry. We are now learning computer entry allows prescribers to receive messages and keep track of antibiotic patterns. If our hospital, let's say, or local hospitals suggest a resistance pattern in certain antibiotics, our prescribers will be able to identify that particular antibiotic. We now have computer order systems that can develop these kind of algorithms through microbiology laboratory tests and see what's happening. This will change prescribing behavior when needed. It will also prevent us from getting to that point once this has been initiated even further. Very important that we start utilizing this right away. And then lastly, we're going to start rotating antibiotic use more frequently. Do not use the same antibiotic over a long period of time. Cycling antibiotics is effective for limited periods within closed environments, especially like areas in the ICU. When cycling, we will have to carefully monitor because monotonic selective pressure of a single agent and possibly the resistance to unrelated classes of drugs can occur. Computer ordering will also help keep track this antibiotic rotation, making sure we're not creating resistance or down effects. We'll also receive suggestions from them, making this a little bit easier on us as well. That will be information we will start supplying. So how are we going to start doing this? We need team development. We're going to start working together as a team in order to be successful with the CQI initiative. The 4 stages, of course: forming, storming, performing, and norming. A personal example: as a past athlete in college, I've been on teams where you don't really work together. You have a bunch of individuals, you aren't successful, everyone kind of cares for themselves. You don't achieve the goals you want to. In a successful team like this one, we're going to work together, we're going to set our goals, and we are going to work together in order to achieve this initiative. We're going to fix this issue, this growing issue in the country. Here is a diagram showing these 4 stages. Forming is the first one there, top right. If you're unclear, you have confusion about what I have just talked about, we can talk about it. Everyone must clean their hands on a regular basis. You should all already know who is responsible in prescribing drugs or ordering antibiotics. This is something that should not be unclear. Be sure to schedule time with me or someone else who knows how to use computer entry. If you don't know how to, you will be learning how to in the near future. This is something we will be heavily introducing. Be a team member, work on these tasks together to be more efficient. Second stage is the storming stage. Start thinking of ideas you can improve these certain processes I just described to you. Feedback is very important, and sharing these ideas about what we do, how we do it, will compete for consideration. There is no such thing as a bad idea. Make sure to be patient with one another and considerate towards other team members. If there's any conflicts, criticism, we'd love to hear it. We need to figure this out in early stages. Next, the final 2 are norming. Clarify purpose and strategy in order to achieve this goal. We have to be cohesive. We have to get feedback. We have to cope with the difficulties, and we have to keep moving. Establish this procedures, get in the rhythm of doing it, and utilizing this initiative. Lastly, we will get to the point where we will be performing this initiative regularly. We will begin to work together on interdependent tasks. There will be motivation to obtain this goal. We'll be flexible. We'll have the resources available. It will be up to you. You will have the confidence. While we start to decrease this growing issue in America, this hospital will take these steps. That concludes my presentation on CQI resistance. Here are my references for this presentation. Thank you.